Hello everyone. In this video, we are going to go over the basic principles in medicine. Specifically, we're going to talk about topics, anatomy, physiology, key vocabulary, anatomical terms. Then we'll go into body systems and structures. Let's get started. First up, let's talk about some of the key topics in anatomy and physiology. For anatomy, you need to know the anatomical position. This is the foundation of anatomical reference. So for anatomical position, the patient is always positioned in this way, standing upright, facing forward. Head and eyes directed straight ahead, upper limbs hanging down at the sides, palms facing forward, fingers extended, and the thumbs pointing away from the body. Then for directional terms, there are a bunch of terms that you need to memorize. But if you understand how they're derived, it makes it easier. So I'm going to try to explain how all these terms are derived, so that you won't have to memorize them. So the terms are derived from Latin or Greek. Let's start with abdomen, which means the part of the body between the thorax and pelvis. Then anterior, which means the front or the belly side of the body. So think of the belly button. So anterior is towards the front of the body. Then there's the breastbone, which is another name for the sternum. The forearm is the region between the wrist and the elbow. So more specifically, it's the antebrachium. And then inferior means lower or down. So if you're standing upright, then your feet are inferior to your head. Then we have lateral, which means the side or the sides of the body. If you were to stand and face the patient, their right side is their right lateral side, and your right side would be their right lateral side. Then medial is towards the midline of the body. So if you're standing in anatomical position, then the midline is right here between the two legs. And the pelvis is the basin-shaped structure that houses and protects the urinary bladder, parts of the small intestine, and the rectum. Then posterior means the back or the back side of the body. So think of your posterior, your butt. Then proximal is closer to the point of attachment or origin. So if you're looking at the upper limb, the shoulder is more proximal than the hand. Then the shoulder blade is also known as the scapula. And lastly, superficial is the top or the surface. So if you were to look at the skin, the epidermis is more superficial than the dermis. And lastly, superior means above or upper. So if you're standing upright, your head is more superior to your pelvis. Then there's the trunk, which is the main part of the body that consists of the thorax, abdomen, and pelvis. Then finally, vertebrae are the individual bones of the spinal column. Now, let's move on to body systems and structures. First up, we have arteries, which are blood vessels that carry blood away from the heart. Arteries always have oxygenated blood except for the pulmonary artery, which carries deoxygenated blood to the lungs. Then capillaries are the smallest blood vessels that allow for the exchange of nutrients and waste products between the blood and the cells. Next, the cardiovascular system is composed of the heart, blood vessels, and blood. Its function is to transport oxygen, nutrients, hormones, and waste products. Then a cell is the basic unit of structure and function in the human body. Cells are composed of organelles, which are composed of molecules, which are composed of atoms. Next, collagen is the most abundant protein in the human body. It forms the framework of the skin, tendons, ligaments, and cartilage. Then the digestive system is a group of organs that break down food into smaller molecules that can be absorbed into the blood. So some examples are the esophagus, stomach, intestines, liver, and pancreas. Next, the gastrointestinal tract is another name for the digestive tract. It is continuous with the respiratory tract, and the opening to the outside of the body is called the anus. Next, the immune system defends the body against pathogens. Then a limb is an arm or a leg. Next, a plane is a flat surface. So there are three planes of the body: the sagittal plane, the frontal or coronal plane, and the transverse or axial plane. A plate is a flat, broad surface. So you can describe something as having a plate-like shape. Lastly, a platelet is a cell fragment that plays a key role in blood clotting. Then the skeleton is the framework of the body that provides support and protection. The adult skeleton has 206 bones. Then a vein is a blood vessel that carries blood toward the heart. Veins always have deoxygenated blood except for the pulmonary vein, which carries oxygenated blood from the lungs to the heart. Then a ventricle is a chamber of the heart that pumps blood out to the body. And lastly, a vessel is another name for a blood vessel. Well, hopefully this was helpful. Make sure to like and subscribe, and leave any comments or questions below. I'll see you next time.